How does such small living organisms lead to cancer?
So broadly, viruses are classified into RNA viruses and DNA viruses. But there are certain danger viruses which causes cancer.
Which are the DNA viruses and RNA viruses which lead to cancer?
The DNA viruses include human papilloma virus, okay, then hepatitis B virus. The virus can be acquired through mother's genital tract.
Welcome to Oncoflix podcast. I am Dr. Lohith Reddy, consultant radiation oncologist at HCG Hospitals.
And I am Dr. Krithika, your co-host, consultant radiation oncologist at HCG Bangalore.
Today, we have another interesting episode on Oncoflix. The topic of discussion is going to be virus, bacteria, and leading to cancer. Today, we have with us our expert, Dr. Abdul Shariff, who is a consultant microbiologist at HCG Hospitals. He has keen interest in virology and immunology. Thank you for coming on the show, sir.
Thank you so much, Dr. Lohith and Dr. Krithika.
To start off with, fever, cold, sore throat is caused by viruses. How does such small living organisms lead to cancer?
Okay, well, viruses are intracellular obligate parasites which primarily derive nutrition from human DNA or RNA. So broadly, viruses are classified into RNA viruses and DNA viruses. Majority of the viruses which causes upper respiratory tract infections are common cold viruses like rhinoviruses and influenza viruses. But there are certain danger viruses which causes cancer. If you look into the oncopathogens, the common oncoviruses include human papillomavirus, Epstein-Barr virus. Cytomegalovirus is known to cause oncogenicity in mice. And they are very interesting because they cause latent infections and can cause danger to human body.
Common cold also has a virus.
Correct.
Cervical cancer is also caused by a virus. Why is that common cold doesn't cause a cancer?
Well, our body takes care of it. Our immune system is so well developed that common cold is diminished by our cell-mediated immunity. So the viruses induce something called as CMI response. The primary infection is recognized as a primary immune response, and then it produces priming of B cells, which help to produce immunological B memory cells. So when there is a subsequent infection by same common cold virus, the antibodies will evade the virus. So generally within 1 week, all of us experience common cold and all of us get rid of it. Whereas the oncogenic viruses with lot of oncogenic potential, they have got certain cell specificity. So you were talking about human papilloma virus. They have got cell tropism, especially towards cervical epithelium in women and penile epithelium in men. So it is known to cause cancers in men as well as in women. So the cell tropism associated with Epstein-Barr virus is nasopharyngeal cell lines. So it specifically produces either Burkitt's lymphoma or nasopharyngeal carcinoma.
So, from a common man language, so common cold has good immune response that has been evolved over time.
Exactly.
So we are able to tackle with it without it causing any latency or any future consequences like cancer.
Correct.
Whereas when we talk of this oncogenic or cancer causing viruses, the immunity is not adequate in everyone to get rid of it.
Exactly.
Right.
Exactly.
Right.
So the DNA viruses, they have a certain potential called as latent infections. They cause latent infections.
So it stays in your body even after the infection.
Exactly. So the bloodstream will not be able to clear the viruses, and CMI, that is cell-mediated immune response, is not adequately developed against a particular virus to get rid of the viral particles.
So which are the DNA viruses and RNA viruses which lead to cancer?
The DNA viruses include human papilloma virus, okay, then hepatitis B virus, which is a class 1 oncopathogen which causes hepatocellular carcinoma
Or liver cancer.
or liver cancer in chronically infected individuals. The RNA viruses include hepatitis C virus, which again causes liver cancer.
So this is usually an area nasopharyngeal cancer.
Okay.
So do people, by sharing food or by sharing drinks, does this virus spread from one person to another and that could lead to a cancer in another person?
Those who are infected, the virus stays within the saliva, tears, and other body fluids. So it's better to avoid close contact with infected individuals. So for that, we have to test the individuals for Epstein-Barr viral DNA. That is either by testing immunoglobulins, by immunofluorescence, or by specifically testing its DNA by polymerase chain reaction.
So, with respect to human papilloma virus, so we commonly know it causes cervix cancer or the uterus lower portion cancer. What other cancers does this human papilloma virus cause?
So there are two risk types of human papilloma viruses. Number one, low risk serotypes like 1, 6, 11, 36, 38, which generally causes genital warts or skin warts. Whereas the high risk serotypes, which include 16, 18, and 31, they are known to produce cervical cancer in women. It is one of the leading causes of cancer in women, and it's a major cause of mortality and morbidity in developing world. Multiple sexual partners, unhygienic practices, lack of menstrual hygiene. These are the predominant risk factors for HPV to transmit from one person to the other.
So how do you develop, vaccines for these viruses? It's possible to develop vaccines for viruses.
Okay.
Okay, is it much easier to develop vaccines for DNA viruses or the RNA viruses?
So, coming to your first question, the only preventable cancer by vaccination which is developed as of now is hepatitis B. H. pylori, there are studies where vaccines have already come out in the pipeline in the final phases of clinical trials.
So you say that because in cervical cancer, only 3 variants or 4 variants have vaccines, and are not all variants of cancer causation human papilloma virus
Yeah.
don't have vaccines.
No, the major risk serotypes, the studies have shown that it will produce immunoglobulins against 6, 16, and 18 serotypes, which gives you lifelong immunity. No vaccine is 100% safer and no vaccine is 100% protective. Repeated doses in pre-pubertal girls should be there is a national immunization schedule which is already involving the HPV vaccine in our country. In Western population, the vaccine was introduced 20 years back itself to prevent CSL.
So, when it comes to this human papilloma virus, what habits if people do? Can they not acquire the virus? B, even if they acquire, will they be able to eliminate the virus instead of going into a latency?
Okay. It's a very good, excellent question. Reducing the partners, so having promiscuous sex, is one of the prerequisites for prevention of HPV infection. Number two, once detected, again, the early detection methods like pap smear has to be performed in every woman at the age of 30, because the virus can be acquired through mother's genital tract, and at the prepubertal age itself, the virus starts multiplying.
So it can stay latent even when they were babies.
Exactly.
Oh.
So there are studies which show that it is acquired through the maternal genital tract. The HPV during normal vaginal delivery, the baby acquires the virus in the mother's womb and during the process of delivery. after doing pap smear, check for the viral DNA.
So once, let's say, they are detected with the DNA.
Hmm.
So what habits, if they follow, will they be able to eliminate the virus?
See, viral elimination is not possible for 100% for that sure. Uh, Having good sexual practices, maintaining good sexual menstrual hygiene, these are the prerequisites for prevention of viral multiplication.
Does diet play a role?
Exactly. So there have been studies which show that albumin, which has got antiviral properties, and polyphenols, which the dietary foods like blueberries, they are rich in polyphenols, and they are known to have anti-cancer activity. Garlic, turmeric,
Antiviral also.
yeah. So these have got natural antiviral properties.
So we were talking about hepatitis B. It's caused by, blood transfusions. There is also shedding of the food, which can lead to transfer of viruses. There is also, promiscuous sexual practices, which can lead to hepatitis B transfer from one person to another. Is there a simple blood test where we can detect?
General population has to be educated to screen themselves for hepatitis B virus as a routine blood test. Just like how you test your hemoglobin to detect anemia, there is a national program by Government of India and WHO consensus report. At 2035, by the end of 2035, we should eliminate the hepatitis B. There are a lot of simple tests which are available in the microbiology testing laboratory. But one thing we have to remember is that the lateral immunochromatographic test, that is the simple card test, might not detect a hepatitis B viral patient because the surface antigen, sometimes the S mutants, will not be detected. The higher end tests, which include E-CLIA, that is chemiluminescence test, or E-chemiluminescence assay, which detects the minute amounts of antigen by chemiluminescence. So these tests are available only in the high-end laboratories. These tests are very sensitive and specific. Once it is positive, you can ask for hepatitis B panel and hepatitis B viral DNA estimation for treatment and prevention.
So when it comes to HPV, we suggest that women are at high risk. So after 30 years, we suggest because it's the second most common cancer that we see in India today. Would you recommend something similar for HBsAg and HCV, which is the liver virus screening also? Which population should we target for screening?
In laboratory, there is a dictum that every sample what we receive is a potentially infectious sample. We don't know who is infected with what unless we screen for testing. So there are two tests, one screening tools and diagnostic tests. The screening test for hepatitis B is the lateral immunochromatography test. HCV is antibody detection or antibody estimation test. General population with drug abusers, with multiple sexual partners, those who are working in healthcare industry, the needle stick injuries, they're also very common where the bloodborne pathogens are transmitted.
Tattoos also, people who have.
Yeah, those who regularly undergo multiple tattoos.
So although there is no guideline, would you recommend a yearly screening or something?
Yes, exactly.
this
That's
high
what
risk?
I'm telling. Whether it might be cancer patients who are undergoing hemodialysis, there are policies where every 3 months you need to test your bloodborne pathogen viral panel test. And in high risk populations, at least once in 6 months, they have to get tested for these bloodborne pathogens.
So we were talking about latency period. If a patient is, infected with hepatitis B, what would be the timeline from the time of infection to the causation of cancer? How long would it take?
Roughly 8 to 10 years.
Okay.
So that is the chronic latency period where the virus will go into hepatocytes and cause fibrosis and then leading to hepatocellular carcinoma.
So is it the same for hepatitis C?
Hepatitis C is rapidly
Progressing.
So within 2 to 3 years, you can see.
So it also depends on the DNA variant or the RNA variant of the viruses as well.
there are alpha genomic variants, beta genomic variants, ABC types, out of which A is more commonly found in India. Subtype A serotype is known to have more carcinogenic potential than B subtype.
So the interesting aspect here is with respect to HPV, if you detect it early with pap smear, the latency period is going to be over 10 to 20 years and you will be able to pick up things even before the cancer is formed.
Correct.
Similarly, for viral infestations like HPSAG and HCV, there are already drugs available to target these viruses, and probably once attacked, we may prevent future consequences like a liver cancer. So it becomes very important to screen these viruses routinely in the high risk population, although it's not a standard established right now.
Exactly.
So what is the fuel for viruses? Is it the sugar? We always, as an oncologist, we say, glucose metabolism and sugar. Does the same concept apply for viruses as well in the inflamed environments where the glucose prominence is taken into account? The viruses depend on glycolysis pathway?
Yeah, definitely. So the viruses will like hyperglycemic environment to where their multiplication increases. Wherever there is hyperglycemia, either it could be fatty liver, or it could be lipoadiposity, or it could be hyperhomocysteemia or hypertriglyceridemia. These are all predisposing factors for heavy viral multiplication.
So, with respect to stomach ulcers and cancers, today saying that I have a ulcer or a stomach issue is very common, and we often find a bacterial association, H. pylori. How is this H. pylori acquired, and what is its risk of becoming a cancer?
Primarily, it is a contaminated water and foodborne pathogen. The Helicobacter pylori is a common oncopathogen which is found worldwide to cause maltomas and lymphomas in the gut tissue. Primarily, initially it causes invasive disease, that is antral gastritis, and then leads to ulcer, and this ulcer leads to cancer. So contaminated hands, contaminated water, contaminated food might transmit this pathogen from one person to other. So proper hand washing techniques have to be employed at school level, at community level, educate the children, educate the elderly, so that we will prevent the maltomas and mucosa associated lymphomas caused by Helicobacter pylori.
And even primary stomach malignancies also because of this ulcer association and chronic persistence of the bacteria. Does that lead to an increase in stomach cancers as well?
Yes, the microenvironment of the gastric parietal cells is entirely altered. What happens is it increases the acid secretion. The parietal cells secrete hydrochloric acid in a large amount, and the mucosa, which is covered with the mucus, gastric mucus, is broken down.
Okay.
That makes the pavement entry for this bacteria to enter into the muscularis propria and the stomach deeper layers to cause craters and ulcers.
So, Dr. Lohith, in your routine practice, when you see oncology patients, you will often find patients with H. pylori infection. So, what advice do you think? What testing do you do in them?
No, I think we just do a rapid urease test to evaluate if at all there is any infection. And if the ulcer is persistent, then probably we, tell the patients to, go in for an endoscopy and get thoroughly evaluated and see how we can manage with, the ulcer and how severe it is.
The kit
Yeah.
also.
So the most important thing is, a lot of population is using vitamin D's, they're using a lot of supplements, magnesium, etc. Do you think vitamin D is kind of a preventive strategy for the growth of Helicobacter pylori, or probably, playing a role in reducing the inflammatory process in the stomach?
If you look into the Indian subcontinent, the population is deficient in vitamin D. So vitamin D gives bone metabolism and calcium strength to the body, core strength. So there are studies which say that deficiency of vitamin D leads to infections. That is why majority of the patients will come with generalized weakness symptoms. And if you test their vitamin D levels, it will be less than 10 international units. Vitamin D supplements definitely give the immune boost effect so that it will prevent any infection for that matter.
There's also literature about vitamin C as well right now. Okay.
Yeah.
Vitamin C, vitamin D play a very important
Yeah,
role in
yeah.
probably changing the microenvironment of the Helicobacter pylori growth in the gastric parietal cells as well.
The dietary habits, the heavy spicy food, and consumption of undercooked food, eating lot of junk food.
Does
There-
hot food also have a role? Extreme?
Yeah, yes.
It does.
Hot food predisposes to ulcers. So the ideal temperature, the food should be warm as equivalent to that of our human body temperature. It should neither be too cold nor too hot.
A lot of people are talking about microbiome. Okay, prebiotics, probiotics. There have been a lot of companies who like manufacture prebiotics, probiotics. Even in clinic, we say a lot of patients to take a lot of curds because that can probably, reinvigorate the microbiome in the gut. We also have a lot of publications where microbiome has shown to prevent cancers. What is your take on that from a microbiologist perspective?
Well, if you look into the gut microbiome, it is synthesized within mother's womb. As the baby, his metabolism starts, once the mother starts giving food to the uh, baby through the placental transfer, uh, the microbiome is developed at that stage. The thymus, the liver, they all start producing immunoglobulins. It has an important role in natural immunity. The innate immune responses are having anti-cancer effects. For example, complement levels. If you look into C3, C4 levels, or if you look into toll-like receptors or menin-binding lectins, these recognize the cancer antigens or tumor tissue antigens, and they submit to natural killer cells. Natural killer cells have got anti-cancer activity, which present through class 1 MHC molecules. If the innate immune responses in the baby is altered due to altered microbiome, there are studies now which are showing that babies who are born through cesarean section have got very less gut microbiome.
I did read about that. So it's very interesting when you say that it's not just about what bacteria is present in your gut right now that predisposes the gut microbiome.
Exactly.
It's there right from your birth. And you develop your first set of defense, what we call as innate immunity, right at birth. And if it at that point there was some alteration, then it leads to an overall alteration in your gut microbiome and your overall immunity, which includes cancer immunity.
That is why we are seeing a higher trend of cancers, leukemias, lymphomas in children. This were never reported 30 to 40 years back, where cesarean was not an option. Now it has become, instead of an indication, it has become a routine.
Yeah. Here again, we always say that, you can't pinpoint and say this is the reason this is happening.
Correct.
It could be, possibly
No,
logically.
it's not logic. It is the lining of the entire gastrointestinal system. If you look into the length of gastrointestinal system, it is roughly around 24 to 32 feet. The amount of microbiome is more than 10 to the power of 30 organisms. You have Bacteroides, you have Acinetobacter, you have Clostridium. All these check cancers. When the infant is born out of a cesarean, half of its microbiome is lost.
Totally.
Okay.
With respect to oral microbiome as well, that where in our cancer patients, I think the significant factor is head and neck cancers.
Correct.
Okay, a lot of people who smoke, who chew tobacco, the oral microbiome could be completely changed. If the balance is lost, that could lead to inflammation and that could lead to cancer itself.
There is a symbiotic relationship between the good bacteria happening in the oral cavity, Fusobacterium fusiforme. These have got symbiotic relationship. They will not allow the external bacteria or the external viral agents to enter so easily. Constantly, there is metabolism happening in the oral microbiome. Only when oral microbiome is altered, then you will get invasive disease. That is why go for natural probiotics is
Yeah.
my advice.
Yeah. So my question next to us that
You don't know how much of the probiotic what you administer is really absorbed in your gut with altered acidic reflexes and altered acidity. In spite of probiotic usage, many of our in our fraternity we see people will suffer from inflammatory bowel disease.
So virus persistence. Does habits like smoking go a long way with respect to persistence of the virus?
Yes, definitely. It's a dual-edged sword. Smoking and viral replication. Smoking reduces the phagocytic activity of macrophages, and neutrophilic enzyme liberation is altered. The myeloperoxidase enzymes, which have got antibacterial or antiviral activity, will be altered. So, smoking enhances the risk for viral infections and cancers.
So, very controversial question to ask. Right now, we see a little different orientation, sexual orientation of people, where we say gayism or lesbianism is becoming more common.
Yes.
We often see sexually transmitted viruses, commonly being oncogenic viruses also. Does these habits or orientation predispose them to acquisition of certain viruses and certain cancers?
Yeah, these are all, as a slowly multiplying viruses, what we call as lentiviruses. They get into the system very slowly, they are detected very late, and they present with full blown picture of either AIDS or other immunodeficiency disorders. Also takes a long time. The community will be affected with bad sexual practices, maybe oral or anal. The dendritic cells in the rectal mucosa is more compared to the natural intercourse area. So these dendritic cells present into the CNS. That is why you see progressive multifocal leukoencephalomyelitis in chronically HIV infected individuals. There are studies, especially in homosexual men or women, the CNS manifestations are more aggressive.
So we were talking about viruses. There has been a lot of research on gene therapy as well, where they use viral vectors to probably kill cancer in a very effective way.
That is the future.
That is the future. So probably a combination of treatments. See, cancer itself is multifactorial. Just one treatment cannot completely cure the disease.
Exactly.
Probably this is kind of an organic way where you're injecting a virus without causing too much of a damage. You're activating the immune system and probably creating an immune impact to the patient and trying to eliminate cancer in an organic way.
FDA has approved clinically, already trials are over, and oncolytic viruses are the future now. There is a tomoglin FEV virus, which is already in pipeline, which might also come to India. They have approved for multiple metastatic melanoma. There are solid tumors which have been treated with adenoviruses. For that, you need to understand the concept. So, if you look into certain non-pathogenic viruses like adenovirus, they are simple viruses present in the environment everywhere. They do not cause harm. You genetically engineer them with the help of CRISPR-Cas9 system. So, you insert an mRNA with it, look into the tumor progression, and give it to the patient.
Perfect.
As a lyophilized preparation. And then the cancer activity is ready.
So this is because the virus multiplies rapidly, so the cells also multiply rapidly here in cancer, so you're able to tackle that rate of growth with this rate of growth.
Yeah.
So that is the whole principle behind
Immunotherapy is the principle.
Right.
The whole principle is immunotherapy.
So
Target the tumor tissue neoantigens, make it normal, reduce the cancer multiplication cells, and eliminate the cancer.
I think giving us an overall view about viruses, bacteria leading to cancer, and what are the latest advances with respect to, viral gene therapy as well. Taking your time out from your busy schedule and having a good interaction with you is such a pleasure. Thank you again for coming on our show.
Thank you. My pleasure.
Yes.
Thank you so much.